This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. Let's begin with a question. What happens when a man's sense of masculinity, intimacy, and confidence is threatened? Not by external circumstances, but by a condition he may have never heard of. That's the reality for countless men living with Peyronie's disease, a condition that silently reshapes not just anatomy, but lives. Peyronie's disease occurs when fibrous scar tissue, known as plaque, forms inside the penis. This disrupts normal erectile function and often leads to curvature, pain, and shortening of the penis. It's like trying to inflate a balloon where one side is stiff. Uneven pressure results in bending and discomfort. While it may sound rare or obscure, studies show that up to 13% of men experience some form of Peyronie's disease during their lifetime. And yet, it remains one of the most misunderstood and stigmatized conditions in men's health. So what is Peyronie's exactly? At its core, it's a structural disorder of the penile tunica albuginea, a fibrous sheath that normally expands during erection. When collagen builds up abnormally, the tunica loses its elasticity. This results in plaque that restricts stretching, causing a visible bend or deformity during an erection. Common symptoms include curvature, pain with or without erection, a lump or palpable plaque, shortening of the penis, and in some cases, erectile dysfunction. Some men may also notice narrowing or an indentation along the shaft, often described as an hourglass deformity. How does it develop? While the exact cause isn't always clear, trauma, either from intercourse or other physical stressors, is thought to trigger the process in susceptible individuals. Inflammation leads to excessive collagen deposition, and over time, the plaque may calcify, making it harder and more persistent. Some cases appear without any known injury. There's also a strong psychosocial component. Many patients experience anxiety, depression, shame, and relationship strain. One study found that over 80% of men with Peyronie's reported emotional distress, and nearly half showed signs of clinical depression. Is it new? Not at all. Peyronie's disease has been described for centuries. But only recently have we made strides in how we approach treatment. One of the most transformative breakthroughs was the FDA approval of collagenase Clostridium histolyticum, an enzyme-based injection therapy that helps break down the plaque and reduce curvature. Clinical trials have shown that it can significantly improve penile curvature in appropriately selected patients. Other non-surgical options include intralesional verapamil, interferon alpha-2b, and mechanical traction therapy. Traction devices apply gentle force to the penis over time, encouraging length restoration and curvature reduction. For patients with stable disease and bothersome deformity, surgical options like plication, plaque incision with grafting, or penile prosthesis implantation can restore form and function. Each approach carries unique benefits and risks. Surgery may shorten the penis, for example, while injections might not work for more severe cases. Despite its impact, Peyronie's disease is underdiagnosed and undertreated. Men are often reluctant to seek help, especially when the symptoms affect such an intimate part of their lives. Primary care providers may not routinely ask about sexual function, and the stigma surrounding penile health means many men suffer in silence. Cultural expectations around masculinity and performance can make conversations feel shameful rather than clinical. To add to the challenge, healthcare disparities affect outcomes. African American men and those with limited access to urologic care may go undiagnosed or untreated entirely. What does treatment feel like for patients? It depends on the method. Collagenase injections are typically given in cycles, with manual modeling done afterward to help reshape the curvature. Patients may experience bruising, swelling, or discomfort, but generally tolerate it well. Traction therapy requires daily commitment, several hours of device use, but is non-invasive and improves both length and curvature. Surgery usually involves outpatient care, and recovery depends on the technique used. Most men report improvement in appearance, function, and confidence when appropriately matched with therapy. At my practice, we believe in personalized care. Every man's anatomy, priorities, and emotional needs are unique. We start with a detailed consultation, imaging if needed, and validated questionnaires to assess bother and functional impact. We ask questions like, is intercourse painful or difficult? Is the curve affecting your confidence or intimacy? Are you more concerned with function or appearance? These answers guide our treatment recommendations. We may use Doppler ultrasound to assess blood flow or consider genetic and hormonal factors that may influence recovery. When it comes to results, the outcomes are promising. Collagenase injections can reduce curvature by up to 35%, and traction therapy improves length and function. Surgical correction, especially in stable cases, has high satisfaction rates, though some men experience mild sensory changes or erectile function issues. Across the board, patients often express profound emotional relief from isolation, confusion, and embarrassment. What's next in the field? The future of Peyronie's treatment is bright. We're exploring regenerative medicine, stem cell therapies, and advanced imaging like elastography to better diagnose early disease. Artificial intelligence may help interpret scans more consistently. New drug formulations, improved traction devices, and patient-friendly tools are under development. We're also paying closer attention to mental health, recognizing that treatment isn't just physical, but psychological. Telehealth and digital platforms are also helping men seek care more discreetly and comfortably. I do this work because I believe men deserve to thrive, not just survive. Peyronie's disease may challenge your confidence, but it doesn't define your future. Too often, men walk into my office scared, ashamed, and isolated. I want to change that. There's no shame in seeking help. There's strength in knowledge and power in personalized care. Whether you're just noticing a curve or you've been struggling for years, there are answers, and there is hope. Thank you for joining us on the Global Men's Wellness Podcast. I'm Dr. Judson Brandeis. Remember, your health is worth the conversation. There's a better way forward. Let's walk it together. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.